Arts Boost was an ambitious new project piloted by Hywel. It was part of Arts and Minds, a national programme across health boards to try to improve mental well-being and mental health through arts engagement.
This project was developed in response to the increase in mental health difficulties and the growing numbers of children and young people seeking support for their mental health from Hywel's specialist Children and Adolescent Mental Health Service.
The project was also based on the growing body of evidence that there is to show that the arts have a key role to play in improving health and well-being, particularly in improving mental health, self-esteem and self-confidence.
We know that there's lots and lots of evidence now that arts in health interventions really improve health and well-being, both sort of psychologically, physically, and they also have lots of social benefits for people as well.
We commissioned 3 arts partners to offer a range of artistic activities with animation, mixed media art and also aerial theatre. We also provided induction training and therapeutic support for our artists.
This programme was offered to all children and young people aged 11 and above who were known to specialist SCAMHS and were awaiting intervention, who were living with difficult relationship maybe to food, experiencing worries, anxiety or low mood.
The sessions were focused around identity and different ways of exploring that, and the young people learned various animation techniques then week by week. One of the great things about animation is that you can create your own world which you have control over, and that can be really helpful, I think, for young people, well, for anyone really.
The thing about an activity like aerial circus is that most people haven't tried it when they first come, and then everyone is on a level playing field, and I think there's something safe about that, about people starting off from the same position.
These have had elements of aerial yoga, well-being and breathwork, leading up to learning aerial circus skills and tricks higher up in the air, and eventually building sequences by the end of our time together. I've seen people gain a lot of confidence from realizing that they can do tricks and skills that they see others do, and that they can go upside down and literally change their perspective. A member of staff at the theatre who happened to have been in the office and observed young people coming and going, she came in and said, "Oh, I don't know what you're doing in there, but I think it's great because I see people coming in looking quite anxious or quite nervous and going out beaming." That was a really nice thing. Sometimes when you're with people the whole time, you don't necessarily see such a marked change.
It is a project that is developing something new, really. It's using artists, facilitators to give that extra support to these young people so they can work through their problems, they can work through their stories, and they can learn new coping mechanisms that can improve their mental health.
We were focusing on journaling as a process, both written and visual journaling, to enable the young people to find a way to express themselves. We were very much about discussion process, so it wasn't just us putting ideas onto the participants. We kind of asked for feedback all the time, and over that period of time we saw a very big change with those young people who connected with us.
The aims of the project were to improve children and young people's well-being and reduce their feelings of distress, to help to develop creative coping skills for life, and to create a safe space to allow for recovery to start. We worked with 2 wellbeing measures, a patient outcome measure. We collected feedback creatively and held interviews with participating children and young people and the artists to find out what the children and young people thought. Overall, we found that the project has real potential to make a positive difference to children and young people's mental health. There's also a number of therapeutic benefits that were identified from the children and young people themselves, and these were improvements in mood and well-being, increased confidence, a development of self-expression and feelings of safety via the provision of a calming and relaxing environment.
Art is the best way I can express myself. If it wasn't for art, I don't think I could express myself as much as I do.
I use art for letting out my anger.
Art is the only way I express my difficulties.
The programme is still very much in its early stages of development, but we're confident that the results are showing that the arts have a real role to play in improving the mental health of children and young people.
And we feel that it's really important not just to be treating illness now, but to be keeping people well, having preventative approaches to health and well-being, and helping people live with illness and giving them skills and sort of empowering patients to be able to manage their own health conditions that they live with.